Welcome back to the For Your Best Self podcast. Dr. Rebecca Novo, and I'm joined with the incredible Heather today.
Hello, I'm
Heather,
excited to be here.
Heather is not only a beautiful patient, but she is one of our exceptional patient care assistants who can be a resource for skincare, injectables, plastic surgery, all the things we do, lasers.
Yes, a
And
little bit of
now
everything.
we're going to be talking about Ellacor today. We've been busy in the OR and taking care of patients in the clinic, so be back in the studio also doing what we love, which is educating and informing. And we have an exciting new procedure that we've introduced to our practice. And Heather is an ambassador for that because she was able to experience the Ellacor. So, a little about Ellacor, and then we'll get into the nitty gritty about the procedure itself and Heather's experience and results. Ellacor conceptually is not a brand new idea. It came from the fundamental idea of a core punch biopsy, which, if you think of a cookie cutter, if you've ever had a skin biopsy, it's like a surgical cookie cutter that removes a few millimeters of skin, the full thickness of the epidermis and dermis. But usually they're of a size where we would have to put a suture or bring the skin edges together. But what the pioneers with Ellacor, who happen to be dermatology and plastic surgery at Harvard, so smart people, they took the idea of the punch biopsy and shrunk that down to a microscopic level. Thought, what if we could fractionally remove a certain amount of surface area of the skin, aging skin, so that we could almost shrink wrap the surface area. So, in a little square of the Ellacor, it removes 64 punch biopsies of microscopic skin. So, in a single treatment, we could remove up to 8% surface area of the lower face. So essentially shrink wrapping, reducing laxity is the number one indication for this procedure. So currently FDA approved for lower face, which would mean any skin laxity or sagging between the cheekbones and the jawbone from ear to ear, covering the chin and upper lip. And we know this is going to neck and eventually body. So I think our practice is pretty progressive about bringing in technology and devices and treatments, but only if we can confidently say it's going to give us a great result. And we've been following Ellacor for a couple of years now, and we're lucky enough to be one of the first 50 practices in the country beyond the researchers that really did the trials for the FDA. So we've been using it and loving it. That's why I wanted to bring Heather in to talk about her experience and impression of the Ellacor. So, with any new device, there is training involved. So, for my training, I was looking for patient models, and Heather, without reservation, said yes. So, what made you so excited about this opportunity to have the Ellacor?
Well, for one, I feel like I would never say no to trying a new procedure. That's just me, and I'm all about trying the latest and greatest. And so when it was presented to me, I was super excited. I immediately said yes. Um, but also, too, that being said, my lower face region, I've started to notice I'm getting a little bit older now. I've had some skin laxity. I've done fillers. I've done other skin tightening procedures, non-invasive, and I wasn't quite ready to go another route. So I thought this was the best procedure for me. I mean, it literally, I feel like I had my name written all over it.
I think, in speaking to new, I think Heather's brave, and sometimes new is intimidating or scares, like, oh, are you practicing on me? Or do you know what you're doing? And if you look at the scope of complexity of what we do in our practice, this is a very simple concept, meaning we are punching and removing skin. We'll get into the kind of the steps of the procedure, but it's really pretty automated. I mean, the practitioner has to be aware of safety first and appropriate depth, and really not over treating can be more harmful. So, with those nuances, and dermatology and plastic surgery are so adept at treating skin, handling skin, working with skin, that as far as safety, this is extremely safe procedure. And also, what attracted us is we were missing the niche of quick recovery. Um, while there's, full results will be in 6 weeks, Heather was able to put on medical grade skincare and go to work 3 days after the procedure, which is, we don't have that skin tightening procedure. Usually it's 7 to 10 days or longer. And this isn't replacing anything. This is really for people with good skin quality. Like Heather has good complexion, good skin. The visible health of the skin is good. It's really addressing laxity. So we'll still rely on our lasers and some of the resurfacing for more texture issues, or use these in combination treatment planning. But well, thank you for saying yes.
Oh, yeah, of course.
I love doing the procedure, and I think we'll only be doing more. So as far as the steps for the procedure, we definitely want to see you in consultation. So we'll do an assessment, look at your skin, are you the appropriate candidate for this procedure? The true contraindications where I will tell a patient no is prescription blood thinners that you're required to take, Plavix, Xarelto, anything that's really cardio or stroke protective, higher risk of bleeding and complications. And there are some skin disorders that we wouldn't treat, but really this is approved for skin types 1 through 4, so even darker skin tones, which a lot of procedures are not available to. We'll talk to you about the preparation, the pre and post care, which you'll hear is relatively simple. We'll do your photos and take a consent. And then it really boils down to the anesthesia and comfort measures. Because this is puncturing the skin, we want to make sure that you're comfortable. So, talk to us a little, share with the audience about your experience, kind of what that was like, that preparation part.
Well, to be honest, I was kind of expecting the worst. So I had kind of prepared myself to have a lot of downtime. I knew that I would probably look a little crazy for several days. And I had my procedure done the week before Thanksgiving, and I had family coming into town.
No pressure.
But that still did not stop me from saying yes. I still was ready to go. But honestly, my experience was amazing. Um, I didn't feel like I had to do a lot of prep. I was nervous, so to be honest, I did take a Xanax right before just to kind of calm my nerves, but I needed no pain medication. I was very comfortable during the entire procedure. I knew that you were working on me. I knew kind of what you were doing, but I could not feel anything. And then afterwards, I was able to really go almost like right back to work. I felt great. I thought that I would have a lot of pain and soreness that evening, and that would maybe require some pain meds, but I did not. Super easy for me. I was very, very impressed.
So the steps for preparation are, we don't necessarily have to pre-medicate with any antibiotics or antivirals. If you had a strong history of cold sores, we may do some prophylaxis. But really, you come with clean skin, and we will wash your skin as well, and then we'll put on a very special compounded, meaning higher strength lidocaine, tetracaine. You might be familiar with if you've had fillers or injectables before. And then we'll offer nerve blocks, which just means injecting anesthesia inside the mouth to target some of the sensory nerves of the face. And then we also add injectable anesthesia once you've had time to topically numb to take the edge off. We basically infiltrate anesthesia under the skin throughout the treatment area. So once we get past that, the feeling is really pressure.
It is pressure.
Mm-hmm.
Um, Probably the most uncomfortable portion of the entire procedure from the beginning to the end was the lidocaine injection.
Injection.
Yeah, and that was uncomfortable, but it wasn't. I mean, it was certainly manageable. And from that point on, I was numb. I could feel nothing.
And then we also use cool compresses throughout to help decrease swelling, and it's also pretty soothing. And we will provide anything a patient feels like they may need for comfort measures, but typically it's been Tylenol. We say avoid ibuprofen, Motrin, the NSAID class, non-steroidal anti-inflammatory drugs, because they do thin the blood and you can get a little bit more bleeding. So usually it's extra strength Tylenol and some cool ice packs, soothing packs. And the post care is relatively simple, gentle cleanser Nothing special. We do have some of our favorite kinds if you need recommendations. And then it's really Aquaphor or a healing balm. We love the brand Elastin Soothe and Protect. It has some extra ingredients for soothing, healing, anti-inflammatory. But Aquaphor over the counter. I think the company recommends Vaseline. So really just a protective balm for the first 3 days. And would you say after 3 days it was kind of more dry and scabby and the skin was ready for the tinted sunscreen?
By day 3, yes. So the first 2 days, so this was over the course of a weekend, so Saturday, Sunday, I was like, I kept myself slathered in the Soothe and Protect. Um, and then when it came to day 3, at that point, I felt like I was ready. I was going back to work, so that was when I was able to use my tinted sunscreen, and that provided plenty of moisture. There was a little residual redness, of course, and some little bit of peeling. Um, Started to bruise at that point, but nothing that was not concealable.
Yeah, and I think that's important to point out. It's not that you're completely healed and flawless to go kind of bare skin presentable. There are some evidence of red, it looks like red pin marks,
Yep.
kind of in a square grid, and they do look a little bit irregular. And when I first was watching the results and the post recovery practitioners, my OCD self was really annoyed that it wasn't perfect grid and everything. But on the 3-dimensional face, it's really impossible to get a perfectly spaced, perfectly symmetrical grid. So the most important thing is that we're not overlapped, that we do have some gaps, we're not over treating. As I mentioned, that's when you increase your risk of scarring. Um, but we've been giving everyone the maximum 8% surface area removal, and then we can control the depth of the removal from 0, which we would never do, but up to 4 millimeter depth, which covers the full thickness of the skin. And the device is novel in that it creates these rapid 64 punches and suction extracts them. Sometimes we have to manually kind of brush them off, but then over 3 days your body extrudes these pores. So literally shrink wrapping to 8% reduction. So that's an A treatment. When they did the studies, their treatments on average received 3. When they did the studies, their patients received up to 3 treatments. And I'm not the type of person that is, say, going to commit someone to 3 treatments. I'm going to say, let's do one, see how you respond. As long as there's laxity, we have a target and we can treat it. I would say wait 3 to 6 months, even though you're going to see a result in 6. We're going to see ongoing improvement even up to 3 to 6 months. So I think it's nice to wait and see the full benefit before we say we're treating. But I think the appeal is the quick recovery or the minimal social downtime, which is really, really important. And we're not able to achieve anything of this power with that fast of a recovery. Aside from your fillers, there's no substitute to fillers if you need volume. As I mentioned, this isn't replacing anything. It's really a new solution. I'd say its strength is nasolabial folds, marionettes, which are really difficult to eliminate completely, even with surgery. Surgery is great for lifting jawline skin, but it really doesn't fully, unless we're adding fat or doing something directly to the nasolabial fold marionettes, from the nose to the chin. This really checks that box. So for follow-up, we see you weekly every few weeks. We're going to see you at 6 weeks and kind of guide you through your skincare regimen. But as you heard, it's pretty simple. We keep it simple. And then if you're looking at patients, who do you see now where you would recommend this patient to?
So, working in clinic, I see a lot of patients who'd be ideal candidates. Those are patients who, like you were saying, have some skin laxity, um, and maybe they've gone other routes, but they are looking for something that's not as invasive or with very minimal downtime. So, I think that this would be perfect for somebody who does have that skin laxity wants a treatment, is not ready for anything, super in depth yet, or even someone who's had, like a CO2 laser or, something like that, and they're looking for another procedure that they can do for skin tightness improvement without that kind of downtime.
Yeah, a lot of surgeons and dermatologists are using this either for someone who's had a facelift as a maintenance procedure, maybe a little bit, it's funny, everyone says, oh, I want something permanent, like surgery. It's just, I have to take a step back and say, truly nothing's permanent. Everything that we do in aesthetic medicine is a reset. We can't control genetics, we can't control lifestyle, we can't control the aging process. So it's not like a freeze, you're never going to age. I mean, some things are more dramatic and powerful than others, but nothing is a time stop on the aging process. That's why we bring in different modalities and tools depending on feasibility for recovery time and things like that to maintain. So I think this is a great either prejuvenation. I think, a lot of people say, oh, I think I look better when I do this, and they kind of pull back up the face, but they're really not truly a candidate for a facelift, and this is a great procedure for you. Or maybe you've had a facelift and you want maintenance. The beauty of this also is that it's FDA cleared for lower face, but people are already out there safely treating neck. That was a big intrigue for this device, as we know it is going to body, and we know it is going to have great applications for acne scars and scars in general. If you can reduce the visibility of a scar 8% or fractionally break it up, make it disappear over time, there's a lot of really cool applications, I think, on the horizon. So how would patients get a hold of us? And this is one of your many
is my
specialties.
area of expertise here. So if you are interested in coming in for a consultation, that is where we would start. So we'd love for you to reach out to us. You can give us a call. The number is 321-241-1160. And one of our amazing team members would be there to assist you with booking your consultation. That way we can have you come in, meet with one of our experts, and they can kind of take a look and see if you're an ideal candidate, and then get you prepared from that point on.
One of the top questions is always, what's the investment or what's the cost? It's going to be $3,000 per treatment through the early part of 2023. I've been told by the company that's low, so we will be going up modestly from there. I think for the first few months of 2023, we'll keep it at $3,000 per treatment. That includes all your pre-care, post-care, outside of some skincare, but that is really quite minimal beyond a mineral sunscreen and Aquaphor or Soothe and Protect. We've put some of the progress photos on Instagram, so if you're not already following us at Dr. Saluja _ Dr. Novo, we love putting educational content on there, showing you real patients' experience and results. And we will be building out an Ellacor page, but you can, they have their own page on the web currently for more information and before and afters, which are pretty compelling. And then, any other questions about Ellacor you think the audience would want to know?
Well, if you were to have any questions that we didn't answer for you, once again, my name is Heather, and I answer the phones pretty often, so you are more than welcome to call the office and ask for me, and I could talk about Ellacor all day long. I loved my experience. I love my results, and I would recommend it hands down, and I would do it again and
That's
again
awesome.
and again. Yes.
It's super special to have you
Yes.
here. Thank you so much.
Thank you.
I think our patients are exceptionally lucky to have team members like Heather that they're specialists, they're just ambassadors for all the things that we do, so they're a resource and someone to have on your team. All right, well, we'll talk to you soon. Thanks for listening to our podcast. How was it? It seemed thorough.
Yeah, that was perfect.
Okay.
I think that was awesome. That was easy. I was
It is
nervous,
easy,
and I was
right?
like, I'm not going to be good at this.
Oh, you're a
I'm not
natural.
gonna say the right thing.
I could tell from the event that you're a